I will call this meeting to order. Benton-Franklin Health District. Today is Wednesday, December 10th. Time is 1:30. We're going to move on to executive session for 5 hours.
You estimated 10 minutes.
10 minutes. Okay.
To include the board, Chris Mertens, myself, Bailey, Maricela, and Aaron.
Okay. We get approval of October 15th, 2025 regular board of health and minute and the other board meetings.
Move to approve October 15, 2025 regular board health meetings. Also October 31st, 2025 and November 5th, 2025. Meeting minutes.
Yeah.
I would just say that on the October 31st, I was actually present. So it just shows me as being absent.
Oh.
We don't want that. Okay.
We have a motion and a second. All in favor, say aye. Aye. Any opposed? All right, guys have it. Okay. Move on to public comment. I don't see anybody in here.
If you would like to make a public comment and you're online, you can either raise your hand in the Zoom app or you can press *9 if you're on a phone.
We'll scroll all the way down.
Will you scroll down?
Okay. Gotcha. All right. Don't see any hands raised. No one here. Public. We'll close public comment. Senior staff comments. Any? Nothing. Okay. Move on to unfinished business. Permitted mobile food vendors update. Center.
I could take the mobile out of that.
Oh.
Yeah, that will look good.
All right. This feels like an awkward position. Wanted to bring you all just an update on the unpermitted food vendor issue and kind of where we've been, what the program has done since we last met. I believe all of you were here for the initial meeting where we brought a little bit of background, but just to recap, we've seen a spike in unpermitted food vendors. We've identified what we believe to be kind of a connected ring of vendors that's connected across the state. We've since heard from the Department of Health that they believe that that ring of vendors extends outside of Washington State in states really all the way up the Western Seaboard. So bigger concerns than just us here locally, but we are trying to lean into local solutions to make sure that we can be coordinated at our local level. So shortly after the last time we met, Maricela is the interim food safety supervisor for our program. We went and had a good meeting with KPD. So Chief Guerrero invited us over to meet with them. Met with KPD. When we got there, there was also representation from the governor's office because they're engaged and interested in this issue, as well as representation from the Fair Play Coalition, which is a business coalition that's formed around this issue. The Latino Community Fund, and quite a few local business owners were engaged in that conversation as well. Local business owners, understandably, that showed up at the meeting are feeling like this is threatening their business and their ability to do business. So there's concern there, and clearly just continuing concern about the public safety aspect there. We made some efforts there to solidify our enforcement relationship. So we've made some steps in Kennewick with our ability to kind of lean on them with shutting down these vendors. I've done a little bit of advocacy at the state level. So I also had a meeting with my counterparts across the state a few weeks after that. And we all collectively got together and agreed that something bigger needs to happen at the state level because there were 10, 15 of us in the room that are experiencing this same vendor operating in their county. So the State Department of Health had agreed to and actually started yesterday steps to convene a statewide task force around this issue. So I think that'll be a really good step forward. We met with public health partners yesterday. We'll meet again on Monday, and then we will bring in partners from law enforcement, state patrol, LNI, all the interested parties to kind of convene a intelligence sharing, unified messaging, and a task force to tackle it at the state level. On the 24th of November, BFHD hosted a community town hall at Pasco High School. So we also wanted to make sure that our community knows that we're, bringing the issue to them and also listening to their concerns, the business community, but also just kind of the general community member as well. I think it was positive. It was productive. We had about 50 people online, about 20 people in the room. So decent attendance for short notice. And we had some community members, some small business owners show up, some other business owners to show up to support pushing the messaging. So we can make sure that everybody's kind of on a level playing field. Today, we presented at the Law and Justice Council, just over here at the Benton County Admin Building. So Commissioner Alvarez helped kind of with some of the connections there. And we're able to present in front of, I suppose, just a community coalition of police, sheriffs,
Yep.
judges.
It had police, all the city police chiefs, city attorneys, city council members, the sheriff's office, you name it. Everybody was here in reference to the law and justice for the countywide within the cities and the county as a whole.
Yeah, it was a really good forum to bring the issue, so we could bring in that element of, we are concerned about public health and public safety in the realm of food safety, but there's also a criminal element to this that we can't, that goes beyond our authority. And so we discussed pulling together a group at the local level as well. So Chief Guerrero is going to work, I think, with Janae and us and get some invites out and convene a local group, hopefully in early January. We'll begin by probably looking at some codes, looking at model codes for the area, and essentially what we can do to close enforcement gaps and strengthen our relationship with law enforcement, unify our messaging here at the local level, so we're not just pushing it from one state to another. So ideally, that task force at the local level may then feed into whatever's happening at the state level as well. So that's kind of our next step, is just engage the broader Tri-Cities area, law enforcement, prosecutors, everything to sort of close those gaps and work on the public messaging around this. So as usual, we remain open to working with the vendors and helping them come into compliance. But until then, we need to solidify some tactics. Go ahead.
So Erin, can you
Yeah.
talk a little bit more about the criminal activity? So that was kind of a red flag for me when I heard that.
Yeah, so a lot of it is alleged, and that's why we need to pull this group together, right? Is to bring in the detectives and the people who have the authority to investigate. But this isn't just here locally, but across the state, there's been a lot of talk of a potential link in with some trafficking. Kind of that element, and yet public health, that's outside of our realm. So we hear this, we hear things from the workers, but now we need to put together a group to feed that to the people who can actually do something with that and investigate. And that is another reason why that statewide task force, the governor's office, has become engaged, because there's concerns that go deeper than just food safety. Yeah.
Yeah, and especially with this traveling up the West Coast, it's crossing state jurisdictions. So from what we even heard today, I think from Chief Guerrero, it is definitely other activities that are going on behind the scenes, where we just have to stay in our lane in terms of our expertise and allow the law enforcement to work through their process.
So the vendors are seeking victims, or
What was the example, Erin, that you heard on a call the other day about someone from Guatemala?
We've had experiences with employees who have relayed to us that they don't know where they're working. They were just put in a van and dropped off. We've heard from other jurisdictions about stories like people coming in on agricultural visas and then being diverted to work at these. So whether it's a criminal element to make money, not trafficking in the sense of,
okay.
there's definitely something that's tangible enough that the state is looking at it. And so we really want to, that's really why we want to connect in our law enforcement partners a little bit more to that investigation piece as well. Thank you.
So with them crossing state lines, is there an outreach to the federal government?
There may be. We're not directly doing any of that outreach, but we would assume that if there is, that's going to happen through that state task force. We want to stay cognizant though of not not kind of mixing this with other issues. So it's a difficult time for that.
I think the biggest thing that we had discussed on that too, after everything was said and done, was, that there is a particular owner or owners and they're contracting out. It's not necessarily the workers that we're concerned as, it's the owner that's creating the issues. And that's one of the different ways to impact ownership on that if they continue to do this. Like I said, a couple months ago, I was over at the Bernina Bridge across from the rest stop. And when I saw families lined up at a non-licensed food vendor, my concern is with E. coli and those type of things we brought up, there's going to be some young children or adults that get really, really sick and potentially die from this. So we're just trying to get a handle on it, So we had some of the city attorneys here. We had the Benton County's prosecutors, this Benton County prosecutor was there as well. So I think it's a good thing to make sure that we message this right. And we make sure we're doing right by everybody here for public safety. This is a safety element.
Sure, of course, but also if those workers are diverted, then the workers are victims too, and
Yeah,
they
exactly.
need
Yeah.
So that's what I'm looking at. That comes on the federal side.
Yes, yeah, and there was a lot of discussion on our state group yesterday about making sure that we're including the right people, you know, in terms of trafficking task forces and the right entities at the state level to address that.
I would also offer that we did meet with the city of Pasco as well. They're very interested in the city council there as well as their city manager of making sure that this is a regional, meaning the bi-county area is
Yes.
responding, right? Because it's whack-a-mole where we shut them down here, they'll go right across the river or just down the road. And so there's emphasis for us right now in our planning to make sure it's the entire area of Benton-Franklin to coordinate this effort.
Yeah, we have to have it unified with a good message and doing the right thing.
Yeah. And then lastly, Aaron, if I could just interject, I know we're out of time, is there's a couple questions that center around Board of Health action at the town hall. And for us, we're always updating you guys and we're moving forward doing the things, but I wanted to take a moment and just pause to say, hey, is there anything you would want to do to formalize your position on, hey, this needs to be done, you know, in the bi-county way? Or is there any interest at all for formalizing so that the public knows it's not just a passive update, but that you guys are aware and you support direction for our area?
I think when Chief Carroll gets together on that, he wants it unified between, public officials, the city managers, law enforcement, that we have that message together. Because we don't want to have what happened in Yakima County, to be quite frank with you, because that's not what we're looking at doing. We're just looking at the public safety and health and safety here in the counties.
Yeah, I thought the unusual part was they're saying, well, what does the Board of Health have to say? And that was the part. I was like, oh, even if we don't do a letter, how do we make sure your guys' voice is represented? And I think we're doing that through the partnerships. But yeah, okay.
Yeah, thank you.
Thank you.
Thanks. Moving on to Dr. Prater, can you give us health officer update?
Thank you. Good afternoon, everyone. Happy December. I hope the weather is, hope you're all keeping safe from the wind and the rain. I have a couple brief things to talk about today. It is the middle of kind of respiratory season, although we're really just getting started, but it is December and we're going to continue to see an increase in respiratory illnesses. A brief update on bird flu and the hepatitis B vaccine has been in the news, so I want to touch on that a little bit. Good news, we are blue in terms of our overall hospital admissions for patients diagnosed with influenza, RSV, or COVID-19. So that blue line compared to the orange and green from the past 2 seasons, we're below where we've been. Although if you kind of look at timing, this is also when we start to see an increase. And we have started to see an increase in influenza. Both COVID-19 and RSV diagnoses remain low. Let's go to the next slide. So I didn't include them, but if you separate out influenza specifically and looking at the emergency department visits, we are seeing an increase in emergency department visits with influenza. That hasn't translated to a significant increase in people being hospitalized with the flu, but we're certainly starting to see just more activity, and that's pretty true kind of statewide as well. Its activity isn't particularly high, but it is increasing. I think the last time we talked about influenza vaccines and that sort of thing still remain the best option to try to reduce your chance of a more serious influenza illness. And if you look at kind of where we're at, sorry, just going back to that graph, we're very close to kind of state levels in terms of our influenza diagnoses in the emergency department. Okay, let's go to the next slide. So I think last time we also talked about bird flu in Grant County. we lost our distinction as the only jurisdiction with a poultry avian influenza outbreak. Not a great thing. I feel bad for Grant County, but it's also nice to have some company. We also we also had on a much more difficult note, there was a resident from Grays Harbor County who contracted avian influenza and died on November 21st. So this is our first death in Washington from avian influenza. This person did have underlying health conditions. They had a backyard flock of poultry and of ducks and chickens, I believe, that were infected with this virus. What made it a little bit unique was that the strain was identified as H5N5. If we don't need to go into the full details, but mostly what we've been seeing is H5N1. And so this is a little bit of a new wrinkle. We've seen it in animals and other birds, wild birds, but haven't seen it in humans. So that was a little bit like, well, what does that mean? Good news is that the state, as well as multiple counties kind of on that side of the state, did an extensive kind of contact tracing once this was identified as avian influenza, and there was no evidence of any human to human spread, which again is kind of our biggest concern when it comes to avian influenza, is that it may mutate and potentially cause human to human transmission that could lead to much greater problems. That Grant County poultry outbreak, they've wrapped up their work on that, and there were no human cases. There were individuals that kind of had symptoms that were concerning, but all of them were tested, and no one tested positive for avian influenza, which is great news. Hopefully, I mean, it's hard to say, but hopefully some of the work that we were able to do in our experiences helped Grant County respond to their outbreak. And I like to think that maybe it prevented cases, but it's hard to know. All right, let's go to the next slide. So these are the same things we've talked about before, but just to reemphasize, because we have had this new case, risk to the general public remains low. It does not spread between people. And we know this very well, that the people who are most at risk are people with prolonged unprotected contact with infected animals, backyard flock owners, poultry workers, or dairy workers. Thankfully, we also have not had a dairy infected with avian influenza in Washington, which is a lot different than some other states. And our kind of prevention tips remain the same. Don't interact with sick or dead wild birds, avoiding undercooked poultry and unpasteurized dairy, washing hands if you're handling any animals. And then biosecurity, we've talked about a little bit, and that's just any sort of methods in your own backyard flock to keep wild birds and animals from interacting with your animals. Fencing, roofing, cleaning, those sorts of things. So those can all help prevent your own flock from being infected. And again, we see it's kind of migration season, right, and hunting season as well. And so all these things are kind of in the back of our mind. Okay, let's go to the next slide. I think this is my last one. Briefly, last week, the CDC Advisory Committee on Immunization Practices voted to change the hepatitis B vaccination recommendation at birth. We've had it since 1991. The actual change was not that significant. If you kind of look at it, it essentially said, instead of recommending everyone get it, if you've had a negative test during pregnancy, talk with your doctor about whether you want your infant to get the hepatitis B vaccine. It's called shared decision making. So I don't think on a practical level it's going to make a big difference in terms of people's access, but I do think it kind of raises some questions. It makes people kind of like a little bit more confused about what makes the most sense. I'm not going to go into all the reasons why. I think it still makes sense to offer everyone the hepatitis B vaccine at birth. But I think the best evidence is just the results we've had from it, which is infant hepatitis B infections falling by 99% since we started instituting this policy. So all that to say, from our standpoint, we still kind of recommend what was previously recommended. But even this committee, changing their recommendations, it's really kind of almost a change in wording that I'm not sure is going to have a huge practical effect. So yeah, that's, I think, the end. Do I have any more slides? No. Great. Happy to answer questions if anyone has any.
Any questions? Okay. All right, thanks, Doctor. We'll move on to review and approval of resolution 2507, Mr. Kyle. Then you also can pull it after that with the state auditor office update.
Okay. So resolution 2507 is declaring surplus of a district owned vehicle. We have a 2008 Chevy Colorado that has 100,000 miles on it, probably closer to 200,000 miles on it. And it needs repair that is going to cost more than it is worth. So we are recommending surplusing this so that the district can get rid of it. Yeah. And Janae has the resolution. You guys also hear that.
Would you like us to read the resolution into the record, or do you want to just work with yourselves?
I already read it. Yeah, we can we get a motion on that?
I'll move approval of the resolution declaring the surplus owned vehicles from the Benton-Franklin Health Department.
Second that. Got a motion in a second. Any discussion? Hearing none, all in favor, say aye.
Aye.
Any opposed? All right, that's how it. Thank you. Okay, auditor office updates.
Great. So as you all know, we go through an audit every year. I came up here and we had our financial audit results, and that we had no findings. After that, they finished our accountability audit, which was more on how we're using the funds. And again, we had no findings on that audit as well. And then we did have a Department of Health audit which was a federal single audit on some of our grant programs that they provide us. And through that, we had no findings in that audit as well.
So are you saying that you're a really good finance person? What time doing that?
I'm not saying that. You're saying.
Well, it's true. That's good. Good job.
Right, yay, good job.
I know how hard that is.
Yeah, we have a good team here, so it makes it easy.
I've been an auditor for the government side and the Coast Guard side, so yeah. Good job.
Thank you.
You want to do the 2026 budget too?
I don't, do you?
Anything else does not want to do it.
Absolutely. Alrighty, Lauren, do you want to bring up the slides, please?
Yes.
Oh, okay. Great. So, yeah, the finance committee met and we reviewed this in depth. So this slide shows a comparison of our 2025 and 2026 budget. The overall budget did increase by whopping $122,908, which is 0.72%. And I will go into more detail on the increases and decreases on the next slides. Our current fund balance is projected to remain steady with this proposed budget. Since it is a balanced budget, we should remain at 8.6 million in reserves. This represents 120 days working days cash on hand and is above our 90-day goal for the year. For revenues, we did see a slight decrease in our licenses and permits. This is mainly due to a volume adjustment from previous years with our current fees. Our state and federal grants decreased as well. There's more fluctuation with grants this year, having COVID been completely reduced. Refugee health services reduced moderately, and others like WIC and water testing grants slightly increased. Our fee-for-service increase is centered around the laboratory's new equipment and additional contracts for water testing services. Vital Records also had a volume increase as well in 2025, so there is an increase in revenue projected for that program as well. So this graph shows a breakdown of where funding comes from. Discretionary funds along with FPHS funds make up the biggest percentage at 39%, followed by federal and state grants at 38%. Then our fee for service and licenses and permits combined for 21% of our total budget.
Got a question?
And
Yeah.
Kyle, so does this assume both counties then?
Yes.
Okay.
It's combined agency. Yes. So our projected expenditures went out on an adventure this year. Our salaries increased by just over $600,000. That was mainly due to the COLA that was approved for the unions and the non-exempt staff. Personal benefits went down. That was due to a retirement percentage from the state that decreased. So all of our staff's retirement and the part that BFHC pays out went down, so that was good. Then we had to reduce our supplies to reflect more closely what was used in 2025. That's not unexpected. Our services was reduced by 10%. Those reductions were a result of the COVID grant ending. Since we reduced our revenue for that, we reduced our expenses for that. Not shown on this graph is lab supplies and vaccine costs that did slightly increase. So on this graph is the breakdown of our expenses. The red and the blue are our salaries and benefits, which make up 75% of our budget. Services and supplies make up the remaining 25%. This chart shows our organization chart. We do have a more in-depth one. It didn't fit on one slide. It's got everyone's pictures, nice and pretty. And this is our staffing level. We have 136 employees. And this is how they fall into those divisions that were on the organization. And then these charts show our revenue and expenditure by division. Community health is our biggest for revenues. They have the most state and federal grants. S&I does more fee and license permits. And then administration brings up the least revenue with mostly discretionary funds. Expenses by program are a bit more balanced. Community health has the most employees by division and make up 41% of our budget. S&I and admin are a little bit closer together at 30%. In summary here, the proposed budget is balanced and only reflects a 0.72% increase over last year's budget. And this will be adequate to cover the duties of the health districts. The finance committee has reviewed the budget and recommends the full board approve it as presented.
I just want to say one thing real quick. When you go back to that previous slide, less than 1% increase over the expenses and costs. You guys did an outstanding job in controlling your expenses and budgeting correctly. I like to see that. We like to do that at the countywide. When I was at the city, we did the same thing. So you guys did an outstanding job. Your staff did a great job. Good job on you guys.
Thank you.
Yeah.
I guess, agreed. Absolutely. 1% increase is amazing, especially given these inflationary times. And I wasn't here at the October meeting, so I apologize if you guys already covered this, but, is Franklin County still in? I don't know. That's probably a stupid question, but moving forward, when you're talking about budgeting, are we including their revenues? Not? What's the status on that?
So as far as we know, yes, they haven't officially said anything that they're pulling out. So if they do, we will adjust accordingly. Currently, their county contributions is less than $200,000 per year.
So Carol, we're gonna continue to pursue remaining by county. But from my perspective, regarding the fees, that was probably another area of concern is having to address rising costs and not having the ability to recover those costs. And
Right.
so my hope is that perhaps maybe early next year in the quarter, we might be able to come back for another discussion with the board to maybe unpack a little bit more of the methodology behind our fees, and see if we can have some more discussion with the bi-county, because we're not gonna stop showing up for Franklin County, even if they're working through, different decisions. We're gonna
Okay.
keep doing what we need to do to take care of the community.
For sure.
I appreciate that. Thank you.
Absolutely.
100%. And you're talking in reference to what we had before about the Medicaid for the insurance side. Yeah, that'll be taken care of. I really have faith on that. Well, that can be fixed.
Yeah, and I also want to let you guys know, before you approve, is that we're still weathering reductions in funding. And so, while we have presented a balanced budget, we are still closely monitoring what is going on at the federal and the state level in terms of our grants, let alone the local fee for service. So we were very happy with the outcome here. To your point, the staff did a phenomenal job this year of trying to maintain our costs and expenses. But next year, we're still gonna run a tight ship to make sure that we can weather that as much as possible. So,
Next year will be more of a challenge for everybody. I already see the writing on the wall. So
yeah.
I think you have a good person steering the ship a little bit on that side.
Great.
Hey Kyle, can we fit
Yeah, give me how many you want.
my pleasure.
Squeeze it in.
I knew that was coming.
All right, can we any other questions? We get a motion to approve the 2026 budget.
Move to approve the 2026 VFHT.
Got a motion and a second in discussion? Hearing none, all in favor, say aye. All right, the ayes have it. Okay, we'll move on to the presentation of 2025 Benton-Franklin County Health Assessments.
While we're waiting for the slides to come up, I guess I'll just introduce myself. Hello, everyone. My name is Pernell Hodges, and I'm the Performance Management Manager here at the Health District. And I am going to present to you the completed, or not the actual assessment, a presentation about the completed 2025 Community Health Assessment for Benton and Franklin counties, which is an effort that my department oversees and represents Benton-Franklin Health District for the development of. And I have clickers, so I can progress in this.
I could definitely prefer.
Do I have to point it in a specific? Oh, no, it's just fine. Okay, just kidding. Right, so just to start, I want to establish what a community health assessment is, because not everyone might know what it is. It is often abbreviated CHA or pronounced CHA. It is one of the, it's one part of the community health improvement process. And a CHA helps us learn about the health of the people in our community. And it is a long, in-depth, and very collaborative process that with the goal of finding out the most pressing health-related needs and assets within the community that could help be leveraged to address those needs. The results are used at a minimum to guide strategic planning and resource allocation to improve the health of the community through a community health improvement plan. But we do use the data and definitely encourage that the assessment be used for other plans outside of Benton-Franklin Health District, as well as other departments and internally within the health district. I have an illustrated timeline here to help you guys understand and all the process and what went into developing the assessment. Originally in September of last year, so September of 2024, the health district representatives, including myself, as well as other members of the community health branch, met together with our partners at Providence or Kennewick and Prosser Memorial Health to create the core group, which is the really the main planning and main work group for the community health assessment. And then later we added representatives from Trios and Lourdes, Greater Health Now, and the Kennewick Public Hospital District. This team met frequently, many points in time weekly over the next year, but we also dropped down to every other week when work was being done and a little bit more slow on progress. In March, we involved more partners into the 2025 Community Health Assessment Steering Committee. And these were representatives from 17 different organizations, community-based organizations or agencies across the 2-county area to support informing the health assessment. And then this group met a total of 4 times for various purposes throughout this year. From February to June, we collected data directly from the community. And from April to August 2025, we also compiled data about the community from dozens of reliable data sources, and I'll loop back to that in the next couple of slides. And then in August, with the steering committee and the core group, we met and prioritized health topics that were identified during the data analysis process to prioritize the most pressing health-related needs in the community. And then for a little bit of an anticlimactic descriptor, we wrote it. And then the next slides, I'll go in a little bit more detail about the collect, compile, and prioritize process. So when I mentioned that we collected data directly from the community, what we did was we collected data through survey responses from the BFHD community survey. We had over 1,000 responses to inform the community health assessment. The survey asks about quality of life and specifically focuses on access to various health services, including physical, dental, and behavioral health, mental, and substance use services. And it also touches on access to basic needs and has multiple choice and open text questions asking about top needs in the community. We also interviewed professionals in various areas across the 2-county area. We interviewed 23 partners in 21 key informant interviews. And these are partners who are working in municipalities or community-based organizations that work directly with the community. And then other key agencies around community health. Then we also interviewed 13 professionals with knowledge and skills and experience in various environmental health sectors about environmental health threats and needs. And then lastly, we hosted 9 listening sessions with 64 community members about the strengths and the needs in their community. And then a quick slide on the compiling of data. We brought together data from 47 outside data sources about our specific counties or cities within our counties to further inform the health status and the assets and the needs in the counties. These included federal agencies like the U.S. Census Bureau, the Environmental Protection Agency, the CDC, et.cetera. It also included state agencies like the Washington State Department of Health, the Washington State Office of Financial Management, the Office of Public Instruction, WA Association for Sheriffs and Police Chiefs, University of Washington, all sorts of organizations. And then we also had some national organizations such as Child Care Aware and Feeding America. When we pulled all of the data together and looked at what it was telling us, we identified a mere handful of 18 topics of potential interest or topics in need of potential intervention for improvement or to improve the health of the community. And those are listed up here. And just in case anybody has just audio capabilities, I'll read them out. They're in alphabetical order. So access to healthcare, air quality, built environment, chronic conditions, connectedness, digital health and access, educational attainment, food security, homelessness, housing, mental health, poverty and income, safety, sexual health, substance use, temperature, transportation, and water levels and quality. In August, when we prioritized with the steering committee and the core group, they were asked to rank all 18 of those topics in order of, and the prompt was, if the issue was solved incompletely or in part, it would have the greatest impact on the health of the community. And we had 5 clear standout topics in order of their ranked order: mental health, housing, poverty and income, access to healthcare, and food security. In addition to ranking those high-level topics, for these 5 topics, we had additional prioritization to what I'm referring to as subtopics to better understand what about those higher-level topics made them the priority. This is to help ensure that we focused on the intended path for why something was selected. So for mental health, standout topics for subtopics were mental health for mental health status of different priority groups such as youth or older adults or men and women, access to mental health services, mental health crisis response, and positive and adverse childhood experiences. Sorry for the abbreviation there. Under housing, affordability and cost burden, housing instability and housing quality and safety were discussed. And then for poverty and income was economic security, poverty in general, and income inequality. And then lastly, food security, specifically looking at nutritious, affordable, and culturally appropriate food. We stand out. The next phase, as I slightly hinted earlier, is the next part of the community health improvement process, which is the development of the 2026 to 2028 Community Health Improvement Plan, also known as the CHIP. We started the process for CHIP development immediately after finishing the draft of the community health assessment. So we're really already underway and well dove into partner engagement. As for the community health assessment, it is published in English on the Benton-Franklin Health District website. It is a very large document, and we're beginning work on translating at least the executive summary into Spanish. And you can find it on our website by going to Data and Reports, Community Health Assessment and Improvement Plan, and the Community Health Assessment CHA. It's on that page, but I've linked it here for those who have access to the PowerPoint directly. And I'm happy to take questions if anyone has any.
Questions? On the translation part, how are you doing that? Are you using like I know I'm gonna say it Chat GPT or Copilot, or how are you actually doing that?
We have a language access plan at the health
Yes.
district.
Okay, perfect. I was wondering.
I will not put it through AI or anything like that.
I was gonna say,
That's not the plan.
another question.
Yes. I was curious, on the top 20, I think, or top 18, one of them was temperature. What did that mean?
Yes, so it was specifically looking at the sort of the calls out from our interviews, as well as the listening sessions, and then the data was showing like high temperature levels, and so there was access to cooling centers or warming centers in the winter. It's a difficult term to just give one word for, but that was the intent behind it.
Okay, thank you.
You said there were 1,000 responses to the survey. How was the survey distributed?
It was distributed through Meta and Google Ads, so it was limited to just people who have technology access for this run around.
All right, thank you. Presentation, community informed assessment of public health communication results.
And Clinton City is logging in 2:45, so we're ahead of schedule.
Are they on?
Because they asked when to log in and it said 2:45 to be safe, because 3 was when they were.
We can jump over to.
Didn't expect to be running this ahead of time.
That's great. Den City is not on yet. Lauren told me just trying to pace this to be on 2:45. So,
Except I need to.
so I can go ahead to give them time. With presentation.
They're gonna come back on then.
Well,
I'm gonna email them and see if they see the email in the next 20 minutes.
All right, then. Are you guys okay with that if I jump over? Okay. All right, Lauren, if you could bring up my slide.
Working on it.
Bright green, that's what happened. Okay, so in your package, you should have 2 handouts. One is a summary of a survey that we've done, and then the other one is just gonna be notes for you to take on from the slides. If you are looking for the actual raw data, I've got a few copies printed out here, or I can email it to you guys. So with that, as part of our strategic plan, which is getting ready to wrap up, it was started about 2 years ago. That's a long time here at BFHD, and things have gone on. So part of one of the priorities that has come out from that was a request from you all to establish the ability for staff to have a mechanism to be able to share their feedback with you guys on an annual basis. And so we conducted that first survey. We got some great feedback. Some of it is a bit tough, but I also think that it's ripe for opportunity. And so as I present the results here today with you guys, I tried to find the best way to categorize it. And to me, strengthening governance felt like the right term to say, how do we interpret this data to be able to move forward? So with that, on our first slide here, I've got clicker, fantastic.
Next. There we go. So background, I just provided that to you, this came from our strategic plan in the areas of improving trust, communication, and our workforce engagement. And in a quick overview, 35% of our staff responded to this survey, and from that survey, their priorities or their values came in the survey for professionalism and collaboration. So taking a look at, so there's two components to the survey. One was to provide feedback on the Board of Health, and then the other one was to provide feedback on leadership. So this first section is talking about Board of Health culture and trust. Descriptors that were listed were toxic, political, combative, fragmented, and unprofessional. However, on the positive side, diverse, improving, and engaged. I liked that component, that while there may be some tension with the first, the positive momentum is happening. When it comes to Board of Health listening, 40% disagree, 24% agree, and then the rest were in the neutral or non-answer category. And then when it came to the Board of Health making informed decisions, 51% disagree, 29% agree, and again, the rest positioned in the neutral non-answer. In terms of themes that were identified from the board, culture was staff felt a disconnect and they wanted more presence and engagement. And that could come up to and including coming into the building, chatting with staff, attending events. Professionalism, concerns about respectful or dismissive behavior during meetings. Politicization, staff report discomfort with political or discriminatory rhetoric and want decisions grounded in public health principles. And then appreciation, consistently engaged members and non-elected community representation were viewed positively. So again, there's a win. They're seeing the change, they're seeing the shift by those that are engaging in our world and that are a good expansion of who we were from even 2 years ago.
Go non-elected.
And Ben County too. Yeah. So speaking of that, let's talk about the positive for a moment. So positive impacts from the board, support for our budgets, our grants, and our staffing. That one is very consistent from the board and appreciated by staff. Approval of wage increases and union contracts. Public advocacy for BFHT's work. One of my joys when I'm reporting out to staff is to be able to say, hey, here's how I've engaged with each one of you. Here's what they're doing in the community. Here's how they showed up for us. And staff love that. They love hearing that. Senior leaders are doing that too, giving you guys those shout outs in the day-to-day operations. And then value added by diverse and informed members. So when you guys are engaging in the discussions, asking questions, they love that. That's great for them. Okay, moving on to organizational leadership and perceptions. So strengths for leadership, transparent, communicative, supportive, collaborative, and aligned with public health goals. Act in the best interests. 62% of staff agreed that leadership acts in their best interest, makes decisions that are communicated effectively. 80% agreed, and leadership is held accountable. Oh, it says held accountable, but 49% agreed there. Next, under themes for leadership, staff mentioned an improved culture marked by trust, emotional safety, and collaboration. That leadership is seen as knowledgeable, compassionate, and mission-driven, and there's clear progress in transparency and organizational stability. So in conclusion, for you guys, staff have expressed a strong commitment to community service and deep pride in their work. They seek a governing board that mirrors BFHC's values of professionalism, integrity, and respect. While the Board of Health is perceived as divided and politicized, staff do appreciate members who demonstrate curiosity, respect, and engagement. Organizational leadership is viewed as a stabilizing strength with clear progress in culture and communication. Continued alignment between staff, leadership, and the Board of Health is essential to building a unified, trusted public health system for Benton and Franklin counties. So with that, and why I wanted to bring this to you guys today is to understand, what do you want to do with this information? I've got some recommendations up here, but ultimately, I wanted to have some discussion of what you guys think of the results and what next steps might look like.
I got a question for you. If you go back to the previous slide, I just want to clear the air on one thing. When it says board is seen divided, curious, board members valued.
Yes.
And I want to say this, and I think that's important because I see a bunch of people online too, about 19 participants online too. You know, I think I've been on the board approximately 3 years now. A lot of you guys have been on, you guys were appointed. And I think we've worked good as a team. I think there's only 2 times out of the 3 years that I've been on the board where it's been a 6-2 vote. And I want to make sure that the board, the people here, that work for our Benton-Franklin Health District know that we have been pretty collaborative on that. Where I said two of the times that I can remember, only two times that the board has voted in a different way, and that was actually 6-2. And so keep that in mind. We'll continue to work hard. We want to have collaboration. I know that myself and Commissioner McKay, we have a track record. I have a track record of being very collaborative with all the cities within the county. So when I look at those things, we'll continue to try to improve and do better. Thank you.
So we do have City on that.
We're almost done, but.
So what do you guys think in terms of, we're getting ready for our new strategic plan, so we can throw in some strategies into that plan. We could do a board culture workshop. We could do one thing that I've heard back from other administrators across the state, and Katie, this is something you've actually participated in, is the Wasalfo Board of Health training. And just bringing in what is the rules and the requirements that are bestowed upon board members. And maybe that might be of value for you guys. We could also set up some listening sessions if you guys wanted to quarterly or semi-annually come in and give staff an opportunity to meet with you directly, ask questions, or if there's any other strategies.
So let me give you my perspective, because I was on the other side of the group here when I was at Kennewick. When you have staff comments in this kind of setting, nobody will talk. I'll tell you this. I was there, I know. No, I have a lot of thoughts, but am I going to talk about it in public setting? No. So if we really want to engage the staff, we need to have more of a private session, and it doesn't have to be all of us. I think the right setting has to be is we need to round on the staff on a periodic basis and have this as a confidential kind of. I'm not saying they need to complain every single time. It could be something, hey, I would suggest this, and keep it confidential. Bring it to the table as confidential and talk about it. For us to expect that this is communication happening in a 2-hour meeting, not happening, and it will never happen. So something along those lines is what I would suggest.
I would agree with that. I know that I would periodically, when I was in Richland, as Mayor Richland, speak as a councilman as well, speak with some of the guilds, the Richland Police Guild. And we had those topics. It was just pretty much open and everybody spoke and they felt comfortable with it. Didn't go outside the room. It was just a way to go ahead and improve things, to move forward stuff. So I agree with the doctor here.
Yeah, absolutely. Anyone else? Okay, so that's from a staff engagement perspective. Is there anything else in terms of board culture or expectations that you guys wanted to explore at all?
So there's a hand up there. I don't know if that's what this is.
No, that's
okay.
Yeah. Well, I didn't know. Are you guys? Was there anything else?
Actually, I would, encourage the staff to tell us, what would you like us to do? Seriously, and with no judgment. Do you have anything to tell us that we can do? I know the theme, but from a practical perspective, what would you like to see?
I know in the data, some of what was provided was centered around just coming here to the building and walking around and meeting with staff or connecting in with group meetings. That was a big recurring one, was just having board members show up outside of the meetings, right? Yeah.
And another thing too, like I said, it doesn't matter who's here working. I have a pretty good reputation too. If you want to have my ear, call me. It can be very confidential. I've learned to respect everybody's personal opinion, and that's how you learn. That's all. I've learned a lot of different things that way, and so I have no issue with someone calling me personally here at the county. So I'm open to that as well.
Great.
Did you say Defense City's on?
Yes.
Oh, it's like somebody has their hand.
Yeah, this isn't typically like us outside of.
Oh.
Yeah.
Sort of, yeah. We're on public comment and everything. Okay, so we'll move on to presentation of community informed assessment of public health communication results.
Thank you.
Hey, hello again. Missed you guys. I'll be officially back January 5th. Baby Mo is 3.5 months. He's doing phenomenally well. And we're very excited for him to be a BAHG mascot. So TBD. You'll see him in the future. So I have Zach from Zen City. And before we toss it over to him, what I have in front of you and for anyone online, basically it's just a quick one pager. I know you guys like to have materials too. There's going to be a lot of data and a lot of information thrown at you. And so, Zach's done an incredible job at constantly condensing. This survey resulted with more than 40 pages of information. Key goals, again, this was a local listening key goal. Those were regional relevance. So we had multiple counties. So we wanted to have a broad impact, especially for our elected officials that are regionally represented. We wanted to be able to have data for them as well, including some of media and other organizations that work just also outside of Benton-Franklin counties that we collaborate with. Neutral approach. This was unbiased. It was open. The questions were sent to some regional leaders, including a senator, some local business leaders, hospital leaders, and also a few members of our conservative community who often challenge our public health messaging to make sure that the questions were appropriate. Our primary goal for this is to communicate respectfully and effectively. And our goal is to meet people where they are. So the sensitive, high profile issues, we've got a lot in the news, we've got a lot to talk about, a lot of things that have to do with public health that we just wanted to really bring forward. And also, last but not least, listening over persuasion. Our goal for the communications team was really to find a way to continue to listen to our local voices to better serve them. And this was more in the realm of a public health communication survey. So it was a little bit different than what we've done, even though some of it overlapped. We did see some positive results, and we are working on ways to effectively take this information and move forward with some recommendations. So that will come later, but I wanted to give you kind of a condensed version, and that is why I sent it over to Zach Gill. And he also has Noah there as well. Zen City is an incredible organization that we've worked with, does some really great surveys. And so he'll be able to kind of give you the full rundown. Take it away, Zach.
All right. Thank you. Can you all hear me?
No, we can.
Okay, great. I'm going to share my screen. Whoever is in charge of the meeting, I just need permission to share my screen. In the meantime, I'll just introduce myself. So my name is Zach, and I work with, there we go. Let's see. Yeah. Right, everyone see that?
Yeah.
Awesome. So I work with Zen City, as Amanda said. Joining me is Noah, who is on our survey team and is the person who did the compiling of this report and the analysis of it. So he's here in case there are, because he's amazing, but also for any methodological questions on the surveying side of things. And so I just wanted to start with just a little bit of an introduction to who we are to help you as the Board of Health kind of understand what Amanda was saying about how this survey was distributed and us as a third neutral party. Then we'll get into the methodology and sample of how the survey was run, and then we'll get to some of the insights. And again, as Amanda said, what you're going to see today is a very, very small section of a much, much larger report. We have a lot more data that we would always be happy to share and talk about. And we'll kind of talk about that at the end.
Would it
yes.
be possible to make that full screen? It's very tiny on our screen.
Oh, okay. Hold on. Let me try. I don't know why that's the case. Give me 1 second.
Oh.
Let's try. I don't know why it's small. Let's try this. Tell me if this gets bigger. Is that better?
Yes, thank you.
Okay. Yeah, no problem. We at Zen City are really in the business of powering the work of government with community voices. And so we work with over 350 agencies throughout the United States, Canada, the UK, to focus on allowing local governments and county governments and state level governments to make decisions about all of the various workflows that they're involved with, everything from budgets to policy decisions to public works, through data, and specifically data on what the residents are saying and thinking. We base this on the idea that everything relies on trust between communities and the government. If your residents don't trust you as a public agency or as a government entity, you're not going to be able to accomplish anything in what you want to accomplish. So this is carried out through kind of the four main parts of our platform: sentiment analysis and social media, community surveys, much like what we ran with Benton-Franklin Health District, experience surveys, so surveys for people who have had direct interactions with a specific public agencies, and then digital engagement, so basically self-distributed surveys and websites designed to generate more resident input. So really, and I'll skip this one for time. So how do we do that? We do this basically with the idea that 95% of adults are using the internet up to 7 hours a day on average. People are checking their smartphones over 100 times a day. And so we've built an all digital system of surveying that's basically designed to target people throughout the community, representative sample, on their phones, on their apps, on, whether that's through Google searching, whether that's through a Bible app, whether that's through social media, and getting them to take these surveys and then using all of that to provide, as I said, a weighted representative sample to whoever we're working with that really, really closely matches their census data. And the reason we do this is based on the idea that many of the traditional ways that public agencies and governments are interacting with their communities aren't necessarily working. So your traditional phone and paper surveys, phone surveys are down to about a 3% response rate. And even then, you're really only reaching the quote unquote head of household. With a mail survey, again, you're only getting one response. When you're talking about public meetings, as you probably know, research has shown that over 60% of people go to public meetings specifically to oppose whatever is on the table. And those people tend to be the same people that you've already heard from and that you're used to hearing from, that don't really represent the full breadth of your community. So what you'll see as we start going through these results is, again, a representative sample of the different counties that we surveyed on this, collected completely digitally according to these various answers. So before I take any questions, and I'll do that as simple, I just want to get quickly to the methodology to give you an example of what that means. And so for this survey, we collected 981 respondents between the time period of September 21st and October 13th of this year. Again, as I said, using targeted ads on various platforms. If you look at this chart, you'll see three different colors. The light blue color is the unweighted demographic. So that is what we collected. The percent of, for instance, 18 to 34-year-olds throughout these counties that responded was 27% of the total survey. The dark blue represents what we weighted that sample to after the fact. And the gray represents what the actual demographics of the 18 plus population are. So you can see on that top left there under age, we took in 27% of total respondents were 18 to 34-year-olds. When we weighted it in the end, basically by taking a random sample to match everything, we brought that up to 31% to match the demographics of 32%. Likewise, we took in 35% of 35 to 54-year-olds, and we weighted that down to 31% to match the 32% of the actual demographics. And so you can see the demographics there, across there. And so I want to take just a quick second to pause and let you kind of digest that, and then see if there are any questions about the methodology before we kind of move forward into the results.
Thanks. We don't have any questions right now.
Awesome. That's what I like to hear. Okay. So we're going to get to the insights into this. And so the first question we're going to look at was actually the sixth question on the survey. But the question was, do you trust public health agencies like the Benton-Franklin Health District to provide balanced, accurate information about health topics? And this is kind of the core question that BFHD was looking for to kind of frame everything else. What percent of the total population of these different counties fundamentally trusts public health agencies? And as you can see, overall, for the total 900 something person sample, 73% of people said, yes, I trust public health agencies. 27%, and these numbers are rounded, said, no, we don't. And so there's two ways to look at that. That 73% is a very big number. 27% is also more than a quarter of the population. If you look below that, you can see the different counties that we sampled. So Adams, Benton, Franklin separately, Grant, Klickitat, Walla Walla, and Yakima. And you can see the numbers for each of those counties. And so Walla Walla was the county that had the highest level of trust in public health agencies, followed by Franklin County at 80%. And Yakima and Adams were the counties with the lowest trust in public health agencies at 87%. Not necessarily a huge split, but the difference between 80% and 67% is certainly significant. We then followed up with a question of where do you turn for health advice you trust? And you can see that this is looking at the total sample. 69% of people said my doctor or healthcare provider. People were able to select as many answer choices that apply here, which is why you'll see that the numbers don't add up to 100%. But you can see the vast, vast majority of people are looking to their healthcare provider for their health information. The second highest number, though, is family or friends, followed by local public health agencies. So you can see that people are looking to their personal healthcare provider, then family and friends, and then at that point to local public health agencies and government websites down there in the 25 to 23%. And then you can also see in the smaller numbers and at the bottom, non-government websites at 11%, social media at 10%, church and faith leaders at 7%, as well as other forms of news as well. Another question was, what makes you more likely to trust information from a public health agency? And you can see that, again, we think of this as trust drivers for information, right? And so again, thinking about this as a communication, informing BFHD's communication policies, seeing consistent, honest communication over time. Again, 50% of people chose that as one of the answers. And so again, I think the stress there on consistency over time, especially, which can obviously be a challenge in public health, followed by when information is focused on practical steps I can take and when it's clear the agency respects different viewpoints. I think it's important to point out that we did not define these categories in any way. It was left up to the interpretation of the person taking the survey in their own mind to define what consistent, honest communication over time means to them. This was followed after that. You can see kind of down at the lower levels, having information come from local people I know. And then you can see the last two that are tied, interestingly, I don't usually trust government agencies and I value public health agencies and don't have any concerns, down at 17%. I'll just pause there for a second. Any questions?
I do have a couple of questions. So
Sure.
On the first slide that had to do with trust, did you look at the database in comparison to the demographics of the population? The reason I'm asking that, if you look at the Walla Walla and the Franklin, the only thing I can think of is probably they have younger generation versus older. Have you guys looked at that data?
Yeah, so we do have demographic data for all of the counties for this question. We didn't include it in this report just because it's a lot of information, but it is available. I will say one of the pieces of information that we did find was that the youngest population was the most likely to trust public health agencies compared to older populations.
Yep. And the other question is, the trust data here, like say on an average, say about 70%, yet when you look at people where they look for their information, it's almost like 25%, a quarter. Why is the gap?
Mm-hmm.
If I trust something, I would expect it that I would look for that, right?
Right.
I like it when they look for local physicians. I'm glad that that's the case. But it's in his family before even the, so why?
Nick, do you mind if I
Yeah, go ahead. I
comment?
was going to say,
Would
Noah,
you
this
would
is a
you
question
mind?
for you.
That's an excellent question. Looking at the disparity there, would you mind going to the slide that has um the question text on it? Yeah, so there is like a bit of nuance here in terms of the like semantic difference in these two questions. So the first one talking about just on a general level, do you trust public health agencies like Benton-Franklin? 73% of them said yes, like on a general level, I do trust them. But this question is specifically asking, well, where do you turn to for health advice you trust? And on face value, these may seem like very similar questions. But looking at that like nuanced difference, here this question is more so getting at when you have like some sort of issue or when you need to know something, who do you go to? And I think that this one is a bit more like clear. I don't want to say obvious, but it is a bit like maybe easier to understand like the sort of numbers that we're seeing in this chart. When most people have like something that they need to know or that's something they're concerned about that's related to health and they need to get advice on the topic, they go to their provider um, probably more often than they would immediately first go to family or friends or a local public health agency.
So it could be in the
Does
question
that,
itself.
yeah,
It could be in the question itself, because the way I read this, where do you turn for health advice? I take it as a personal health advice. Maybe that's how they took it, is, if I have high blood pressure, yeah, I'm not gonna call Department of Health and say, hey, what medication should I take? Maybe it's in the question itself that makes it more personal, and that's why I probably got my doctor. If you really wanted to gauge what a public agency would do, the question maybe should have been phrased differently if that's the intention. Just my point.
Absolutely, yeah. And one of the things we always talk about, of course, is that when you run a survey, you always end up with a whole list of additional questions that you now want to ask or that you should have asked. But I think also from a messaging standpoint, it does, I think, raise an interesting, positional piece and sort of about where does, health agencies like BFHD, where do they see themselves positioned in this conversation? Do they want to be a place where people think of, when it comes to looking for public health advice, do you want to be positioned as a place that people think of to go to there or not? And if so, where does that communication come in? So it certainly raises, I think, a lot of questions for messaging on Amanda's team in terms of, and, sort of the identity of a public health agency in the community.
I understand your question, but the only thing is I would say there was a missing key word here, is turn for public health advice versus health advice. If you say health advice, to me, that's a personal health advice versus a public health advice. If I wanted to know about the flu epidemic, I'm not going to ask my doctor. Probably I'm going to look at what's been published versus a health. That's how I see it. But
I think the question too is, do people know the difference between health and public health? Does our community truly understand what public health does? And that's kind of, I think I'm taking a bunch of notes, but I think that's kind of where we fall into it, kind of what Zach was mentioning, not defending this, but just looking at all different aspects of how do we want to be branded and what does public health do? To be honest, I didn't know what anyone did until I started working here. So I think those are really great questions. And I know who's on my team for surveys next.
Yeah, I mean, if you really wanted to split just from a statistical perspective, you could have asked the question in two ways. One is health advice, personal health advice versus public health advice, and actually see how they respond. And then you can actually create that differential.
If I use the term.
You could say my doctor or pharmacist. I mean,
Yeah.
Talk about who talks to people minute of the day.
But see, they could have done healthcare provider.
I see that, but that provider word is really straight out of Brazil anyway.
Okay, so for the sake of time, just moving forward a little bit. And again, on the messaging aspect of it, which tone or approach makes you more open to public health messages? Straightforward and factual at almost 50%, followed by science and evidence-based data, followed interestingly by respectful of personal or family values. And you can see the other ones down there: encouraging without pressure, real stories of personal experience, community and responsibility focused. And again, in the full report, we have a lot of cross-question analysis for a lot of these questions. So basically breaking it apart of among those people who said they trust Benton-Franklin Health Agency, how did they answer this question versus those people who said they don't trust agencies like Benton-Franklin, how do they answer these? And as you can imagine, in that I don't trust public health agencies as much category, you see that respectful of personal or family values number increase. Whereas people who fundamentally trust public health agencies to begin with are kind of more interested in the science and evidence-based data and the straightforward and factual aspects. And so again, pages and pages of data and cross-question analysis available. So we also asked some additional questions. And so these questions were basically looking at confidence in vaccine decision-making. And basically, so ask the question, how confident do you feel in making decisions about vaccines for yourself or your family? Right. So it's not asking, do you trust vaccines or not? It's asking, do you feel comfortable and confident in making your decision? And so these were answered, I feel very confident, I feel somewhat confident, I'm not very confident or not at all confident, and then not sure. And you can see on this, 58% of the total respondents of those 900 something said, I feel very confident. 28% said, I feel somewhat confident, and then about 11% saying, I'm not very confident. I don't feel confident at all in making these decisions. Looking at that breakdown by county, you can see Grant County had, by a considerable margin, the smallest percentage of people who feel very confident. Adams actually had the highest percentage of people who feel very confident. Grant also had the highest percentage of people saying kind of not very confident there. Otherwise, you can see throughout most of the counties, other than Grant, it's very consistently right around 60%, right somewhere around 30% or so for somewhat confident, and then the rest. And again, just to follow up, similar to the trust questions, we have cross-question analysis for these questions based for all of the rest of the questions. So what percentage of the very competent group said this is where I turn to, and then we also have it demographically. So I know I said that the youngest population was the population by age most likely to trust public health agencies. Interestingly, that young population was also the least confident in their vaccine decision making. So they tend to trust public health agencies. They're not very confident in their decision making. And so that's one of the areas, for example, that kind of jumps out as a clear messaging point of view. People, if they already fundamentally trust public health agencies, but they're not very confident, they will, in theory, be more open to messaging from Benton-Franklin and similar health agencies.
And if I can make a quick comment, I'm not surprised by that because most of the young population rely on social media to get their information, health information. And that tells us if we need to reach this population, doing something by paper is not going to work. You need to go into social media. Take the real message to social media.
Yeah. And of course, and the young population, they are generally not as set in their ways about things and especially, have grown up in a period where vaccine conversation has been much more relevant and common. And so it certainly makes sense. We follow that up with which of the following vaccines do you trust? And you can see the list of vaccines here. And again, I'll let everyone kind of read through these rather than reading them out. But you can see on the high end, the MMR vaccine, trusted by 53% of everyone, of the people, and on the low end, RSV by 36% of the population. Similarly, we have cross-question demographic analysis for this question too, to look at what percentages of which populations trust which vaccines. Question 12 was, how do you think schools should approach student health when it comes to vaccines? Again, this was a single select. And so 27% said require vaccines for school attendance with medical and religious exemptions allowed, which so consistent with the policy. 23% said strongly recommend vaccines, but leave the final decision to families. And 17% said allow parents to opt out of any school-related vaccine policy without explanation. So a much closer split in terms of where people stood on this question. What type of support or information would help your workplace or business keep employees healthy? 48% tipped for encouraging sick employees to stay home without fear of losing pay, followed closely by clear, non-political information on what vaccines are available and who they help. And then advice on how to reduce illness spread in workplaces. A few more afterwards, low-cost vaccine clinics for employees, guidance on policies that support both public health and local business, and easy-to-share materials, down at 26%. So that is the part of the survey that we worked with Amanda and team on to present to you, to give you a very focused highlight of this data that we selected. As I mentioned, we have much more data. We would be very happy to walk anybody through, give a kind of customized data report to anybody. There's a lot of information there, and we are very encouraging of it being publicly accessible, and being very open and honest about the methodology behind it. Are there any other questions about kind of the data that you did see?
Good.
If I could just offer a couple of things. One, Zen City, I want to say thank you for you guys doing this. And I know this is really just a tiny fraction. So if any of you are interested in the full presentation, let me know. I'd be happy to send that over to you guys. I want to thank Amanda, who has spearheaded this. This, I think, stemmed in part from a conversation with Senator Banky on understanding for our elected leaders and our stakeholders in the conversation of public health, how we can work on trust. And not because people won't trust BFHD, but when we come into topics more and more that are politicized, how do we navigate through that, staying true to what our values are in public health and the values of our community? So I love where this survey is leading us in the discussion, because while we're being challenged at different levels, I think it brings the opportunity to take a look at our work differently and how we communicate and how we connect to get our messages across. So thank you to all of you that would help with this. And again, we're happy to have more conversations too.
I think it's encouraging that Franklin County had such a high
I
level
know,
of
right?
confidence in BFHD. It's great. So.
Absolutely.
Yep, you're doing a great job, is what I would say.
All right,
Great. Thank you very much. Thank you very much, everyone.
I'll move on to Board of Health election of officer positions.
I did have one quick question, one comment. Is that okay? Since we're talking about graphs and charts and percentages, I want to get something right because I was wrong. Out of the 6-2 votes, out of about 36 meetings the last 3 years, it was 6-2 twice, 2-2 once. So there was 3 times. One was health and food inspections. One was septic. So I want to clarify that. And the third one was on the financial when it comes up to Medicaid fees, those type of things like that. And I'm going to I always look at the glass half full versus glass half empty. I saw about 1/3 there we had comments, but there was 2/3 that were indifferent or were potentially happy.
Yeah.
I'm going to take it on a positive note as well.
Yeah.
So we'll continue to move forward. Okay.
Absolutely.
Thank you. Sorry about that, Commissioner Kate.
All right, can we get a motion for chair and vice chair?
It's that time of year. So January is when we will start the new officer positions. As a reminder, they are open to elected and non-electeds. But we just need to get us set up for January 2026.
It's my birthday.
January 2026?
Yeah.
How are you feeling?
You know,
It feels great.
there's a couple, there's a lot of things we need to do and improve. I'm not I don't like the politics side of it. I think you guys know that. I base it off education, base it off staff's recommendations, and what the public has to say. And so I know some of the things that were more politicized, is if you're asking me that question, I look at the chair as a facilitator and running the meeting and getting staff together and public together and board members together to make those decisions. So, yeah, I'm okay.
And because of that, I would like to actually make a motion to nominate Commissioner Alvarez for chair position since.
I'm going to be the chair of our board next year. I'm going to be working a lot.
We have a motion and a second. All in favor, say aye.
Aye.
Any opposed? Okay.
So we had a meeting that was.
I don't know.
And I thought it was really nice that we had a voice of experience who knew when to call for a point of order and get things under control. And I'd like to nominate Carol for vice chair.
And I would second that.
You're gonna punch me in
Mostly by osmosis, I got.
We got a motion and a second. All in favor, say aye.
Aye.
Opposed? All right, the ayes have it.
Are you okay with that?
Yeah. You're up my
Move
game.
on to WSNA bargaining. Brandy?
Okay, so Brandy is not available at the moment, but I have her announcement. So bargaining has officially begun with the Washington State Nurses Association, and we are committed to negotiating in good faith to reach a mutually beneficial agreement. We will keep the board updated on key milestones and the overall progress of these discussions. Okay.
Can we get approval of vouchers?
I move that the Board of Health approves the payment of voucher numbers 86-2025 through 101-2025 in the amount of $2,149,505.11.
I'll second.
Motion and second. All in favor, say aye.
Aye.
Any opposed? All right, the ayes have it. All right, next board meeting is January 21st, 2026. And before we close, I just want y'all to know, I know Santa. I have to work with that guy. I know Santa.
Everybody, and happy
This
holidays.
meeting's adjourned.
You as well.